Hello, I think we are live. Let me make sure that my settings are correct. Let me see here. Let me just make sure. Okay, I think I'm good. Okay, my name is Tim Westbrook, and I'm the CEO and founder of Camelback Recovery here in Phoenix, Arizona. We also have sober living homes in Scottsdale, Arizona. And as many of you know, we recently opened up an outpatient treatment center, outpatient treatment clinic in the Biltmore area of Phoenix, Arizona. And our outpatient clinic is focused, one of our focuses is mental health, treatment for mental health. So not just addiction treatment, but also treatment for mental health. And so since we've opened, I have received a few questions around mental health. So those are the questions I'm going to address today. And let me see here. I'm going to actually type some of these questions in here. So first question, what is mental health treatment? What is mental health treatment? And let me show it. Okay, what is mental health treatment? Mental health treatment is an umbrella term for services and therapies that address mental and behavioral health disorders. It can refer to any specific treatment or a combination of treatments. There's no one specific mental health treatment that works for everyone, and every treatment is never a one size fits all solution, which is similar to addiction treatment. It's not one size fits all. There's a different solution for every single person. So mental health treatment should be tailored for each person based upon the type of mental illness and the severity of their illness and their recovery needs, goals, and preferences. Doctors and therapists are quality and accredited and licensed mental health treatment facilities will usually collaborate to develop customized treatment plans for every patient who comes to them for help. Mental health treatment is widely available in both inpatient and outpatient settings, and those with severe mental health disorders and symptoms may receive treatment in a hospital-like inpatient setting or a supervised, closely monitored residential setting. Those who need help managing mild mental health disorders may work with their primary care physicians in an outpatient setting. And treatments for mental health are also available at many drug and alcohol rehab centers, like Camelback Recovery is one of them. Given nearly half of people with substance use disorders also have a mental health disorder, and vice versa. Though mental health treatment may be widely available, it's important to find a quality provider that focuses on whole person health so that you can thrive and be more successful in every aspect of your life by the time your treatment program has ended. Next question that I have here, who needs mental health treatment? Okay. Who needs mental health treatment is the second question. Anyone who is not receiving therapy or medical care for their mental illness can benefit from mental health treatment. If you think you might need some mental health treatment, you probably need mental health treatment. Just like when someone starts wondering if they might be an alcoholic or a drug addict, probably means they're an alcoholic or a drug addict. And many times, symptoms of mental illnesses can be overwhelming and difficult to deal with, especially when they start interfering with your usual activities and overall livelihood. When your mental health starts to get in the way of your normal activities, when you start making decisions on whether or not you will do something because of your mental health, it's probably time to start seeking treatment or start looking into treatment at least. Some mental illnesses can also cause physical pain, such as the unexplained aches and pains that often accompany depression. And these aches and pains are real. They're real aches and pains, even though they stem from the mind. You may need mental health treatment if your condition affects your ability to be productive at work, productive at school, in your household. And treatment can also help if your condition affects your social life, your relationships, your sleep, your appetite, your activity level, and your overall general well-being. Mental health treatment can usually benefit you even if you think it's not necessary or that you're tough enough to face it on your own without help. Mental illnesses are often chronic health conditions that require professional treatment and rarely ever pass on their own. When left untreated, a mental illness can increase your risk for worsened health, substance use disorders, and even suicide. Okay, the next question I have here. What are the types of mental health treatment? Are the types What are the types of mental health treatment? First type is medication. Mental disorders are commonly treated with medications or behavioral therapy, or a combination of both. Behavioral therapies can include any one or a combination of therapies, including support group meetings and cognitive behavioral therapy, or CBT. Now, back to medications. Certain types of medications are designed to address chemical imbalances in the brain that contribute to some mental illnesses. For example, depression is associated with reduced levels of brain chemical called serotonin. Therefore, your doctor may prescribe one or more antidepressants to increase your serotonin levels if diagnosed with depression. Medications may also be used to treat specific symptoms of your mental health disorder. Types of medications commonly prescribed for mental health disorders include antipsychotics, which can promote clear thinking and help you stay organized and focused on reality. These medications are often used to treat conditions like schizophrenia. Antidepressants, which can reduce feelings associated with stress, depression, anxiety, and suicide. Mood stabilizers, which help reduce or eliminate periods of extreme highs and lows associated with conditions such as bipolar disorder. Tranquilizers, sleeping pills, and benzodiazepines, which can reduce insomnia and treat symptoms of anxiety disorders. Then we have stimulants, which can improve concentration and attention to people with disorders such as attention deficit hyperactivity disorder, or ADHD. Everyone responds differently to medications, meaning you may need to try several medications before finding the one that works best for you. Of course, you're going to work with a doctor on this. If you decide to start taking medications for your mental illness, your doctor will stay in close contact with you to make sure it's working as intended and will change your dosages or medication as needed to help you stay on track with healing and recovery. Then we have psychotherapy, also known as talk therapy. Psychotherapy involves working with one or more therapists to explore your thoughts, feelings, and behaviors to uncover and address the root causes of your mental illness. Psychotherapy can take place one-on-one or in a group setting. CBT, dialectical behavior therapy, DBT, and exposure therapy are some of the many types of psychotherapy you may receive as part of a mental health treatment. These therapies are often helpful at teaching you how to cope with symptoms of mental illness and with situations that may exacerbate your condition. In some instances, psychotherapy may also help you face and overcome trauma or past experiences that you may have led to your mental illness. For example, if you develop post-traumatic stress disorder, PTSD, after witnessing a violent event, you may receive exposure therapy to address your fears and alleviate symptoms of PTSD. Hospitalization. Hospitalization is a service for those who need to be closely monitored in the event their mental condition worsens or becomes life-threatening. For example, those with bipolar disorder experiencing an extreme episode or mania may benefit from hospitalization so they can have their medication dosages adjusted and be supervised to ensure they do not engage in risky, dangerous behavior. Also known as inpatient care, hospitalization can take place in either a hospital or a smaller private psychiatric clinic or residential treatment center. Then we have case management. Case management is a service in which a designated case manager coordinates and oversees the services and treatments for a specific patient. A case manager can help you find mental health treatment and work closely with your doctors and therapists to ensure you are getting the type and level of treatment you need and deserve to become healthier. Case management can often reduce your burden to finding and maintaining quality mental health treatment. Okay, then we have support groups. Support group programs are meetings that take place with peers who have the same mental health disorder and can share similar issues and experiences. Peer support groups can often make you feel less isolated and alone and open your eyes to new strategies and tips related to living and coping with your mental illness. These meetings can give you these meetings can give you a haven in which to talk honestly and openly about your mental illness without having to worry about others passing judgment. They are also usually free to attend and included with most mental health treatment programs. So that's just like any sort of a 12-step group, CODA, Al-Anon, Alcoholics Anonymous, Codependency Anonymous. Those meetings are great. Great to be a way for you to be around other peers and other people with similar issues. And that's proven to be super helpful. Support groups are available for nearly every type of mental illness, including depression, PTSD, bipolar disorder, behavioral addictions, and substance use disorders. These meetings are available in person, online, and over the telephone for your convenience. Then we have alternative and natural treatments. Many people with mental health disorders prefer using natural treatments over drugs and medications, or may seek them to complement their existing medication regimens. Massage, yoga, herbal supplements, nutrition, exercise are many of the remedies and treatments that can effectively improve your mental health condition. If you prefer alternative and natural remedies over traditional medical treatments, mention this to your doctor and therapist and when exploring your options for mental health treatment centers. At Camelback Recovery, we work with you to develop the best possible treatment plan that aligns with your personal health goals and preferences, even if they revolve around natural treatments and solutions. Next question. What is dual diagnosis? What is dual diagnosis? Someone diagnosed with both a mental illness and a substance use disorder is known to have a dual diagnosis. Also known as a co-occurring disorder, a dual diagnosis must be treated using specialized therapy that addresses both disorders simultaneously. Otherwise, the person can relapse back to the drug and alcohol use and may never learn how to manage or recover from one or both disorders. Dual diagnosis is highly common and affects an estimated 50% of people with a mental illness and 50% of all people with a substance use disorder. Symptoms of any mental illness can be difficult to cope with, especially for someone who isn't receiving any form of treatment. Many individuals with mental illnesses may try using drugs and alcohol as a form of self-medication to reduce their symptoms and try to feel better. Unfortunately, drugs and alcohol are usually only short-term solutions for mental illness and can make symptoms worse over time. On the flip side, drug and alcohol addiction can increase a person's risk of developing a mental illness. Chronic use of drugs and alcohol can lead to changes in your brain chemistry and alter levels of important chemicals like serotonin and dopamine that play a role in your mood. After a period of heavy drug and alcohol use, you may lose pleasure in normal activities and suffer anxiety and depression as a result. Certain types of illicit drugs like methamphetamine can even trigger paranoia and psychotic behavior that requires hospitalization to prevent violence, suicide, and homicide. And that's it for what is a dual diagnosis. Next question. How is mental health treatment integrated into addiction treatment? How is mental health treatment integrated into addiction treatment? Many drug and alcohol rehab facilities offer dual diagnosis therapy and other mental health treatments in all their programs. At Camelback Recovery, we understand the importance of treating dual diagnosis and screening all patients for mental health conditions upon arriving at our facility for addiction treatment. All our mental health treatments can be easily integrated and included in your addiction treatment program so that you can experience a fulfilling recovery from both your mental condition and substance use disorder. Drug and alcohol detox is the first treatment that will be administered for patients with a dual diagnosis. Detox helps you get safely through withdrawal and recover from physical dependence on drugs and alcohol. Medications can be used to minimize your withdrawal symptoms and help you feel more comfortable. Detox can take several weeks or several days, depending on the severity of your addiction and how you respond to treatment. Mental health treatment facility. After you complete detox, you can start receiving behavioral therapy or dual diagnosis therapy. That addresses both your mental health condition and addiction-related behaviors. For example, you may learn special skills that teach you how to manage symptoms of depression and anxiety without resorting to drugs and alcohol. Camelback Recovery understands that everyone has their unique story and situation as it relates to addiction and mental health, and is devoted to developing a customized treatment plan that will cater to your specific situation. We'll do whatever it takes to ensure you're getting the mental health treatment you need to successfully recover from and/or manage your dual diagnosis. How is mental health treatment integrated into addiction treatment? Okay, next question. I think this is the last question. Where can I find mental health treatment? Where can I find mental health treatment? Where can I find mental health treatment? At Camelback Recovery, we offer mental health treatment in both our partial hospitalization program, PHP, and intensive outpatient program, IOP. We also operate 4 sober living homes for men and women who live in or near Phoenix or Scottsdale, Arizona. Camelback Recovery provides treatment to residents across the state of Arizona and greater Phoenix area, which includes Scottsdale, Tempe, Mesa, Gilbert, Chandler, Glendale, anywhere in Arizona. And we actually have people that come to Camelback Recovery from all over the country. So we are located in Arizona. So if you think it's time, you think that a geographic or moving to another location or coming to Arizona, or if you want to come to the Arizona location, then Camelback Recovery, like I said earlier, we offer sober living homes. We have 4 sober living homes in Scottsdale, Arizona. And then our treatment program, our outpatient clinic, is in the Biltmore area of Phoenix. So if you're willing to travel, then Camelback Recovery could be an option. Either that, or you can call us and we can help you find a location that is in your area, wherever it is that you live, whether you're on the East Coast, whether you're in Oregon, whether you're in Philadelphia, whether you're in Florida. We have contacts all over the world. So call us today, 602-466-9880, to learn more about our therapy options. But if we're not able to help you, we can help you find a location. That's a service that we provide. We have a community liaison on staff, and our community liaison's job is to help people find treatment in another location or at another facility if our treatment program is not appropriate. Where can I find a mental health treatment? Okay, that does it for today. That does it for today. Thank you for your time. That's it. I'll catch you next time. And this Wednesday, be sure to tune in. I am interviewing Dr. Joan Rosenberg, and she wrote this book, 90 Seconds to a Life You Love. We're going to talk about grief, and as grief is the pathway to forgiveness, how to master your difficult feelings to cultivate lasting confidence, resilience, and authenticity. Joan Rosenberg. So really looking forward to that. That's going to be this Wednesday at noon Pacific Standard Time. Thank you.